Thank you, everyone, for joining today's Health and Human Service Committee meeting, Monday, July 6, 2020, at 6 p.m. HPA-TV will be broadcasting tonight's City Council Health and Human Service Committee meeting live on Comcast TV, channel 96, and Frontier TV, channel 6032. It would also be streamed live on hpatv.org and the HPA-TV Facebook page. It will then be made available for future viewing on the HPA-TV YouTube channel. So before we start the meeting, I'd like to do introductions. So we'll start from the left, and if you're a council person, just say if you're a voting member or not. So Councilwoman Rossetti?
Here, and I am a voting member.
Councilman Sanchez? You're on mute, Councilman Sanchez.
Present, and I am not a voting member.
Corporation Counsel, Mr. Osborne.
Assistant Corporation Counsel, DeMar Osborne.
Director Liani.
Liana Arroyo, Director of Health and Human Services.
Majority Leader Clark.
Good evening, Majority Leader Clark, present, voting member.
All right. Thank you, everyone, for the introduction. So today we have 3 agenda items. The first agenda item is referred item number 12 of council meeting June 8th, 2020. It was introduced by Councilman Sanchez and supported by Councilman Gale. It's a resolution urging the Department of Health and Human Services, the Department of Public Works, and other departments to participate in using existing completed research of far UVC lighting for an added extra level of disinfecting. So I know, Councilman Sanchez, you introduced the resolution, so the floor is yours.
Thank you. So this resolution is based on the original resolution, which is similar, that was introduced a couple of months prior to this one. So basically, just thinking about the situation that we've been in and the future, what's going to hold for us. As I'm sure you all know now, there's been a second a mutated strand of COVID-19 that they just discovered. And I think is a situation that we definitely still should start looking into what other technology or ways that we can help to disinfect and keep the public safe. And so one of those things is the far UV light. I introduced this thinking outside the box on what we can do to help the citizens to come into the city hall and feel safe with an extra layer of security when it comes to disinfection. So it's my understanding that folks thought that this UV was going to be used on people, and that is not what this resolution is about. It absolutely will not be used on people and or animals, such as dogs and cats or any other pets that a person may be having, accompanying them. So that's I want to make sure that people understand that this is not to be used directly on them. This is mainly, for example, we can use it in an air ventilation system. So when the air is being drawn into the system, you can have a set of UV lights there to disinfect the air that's entering, and also at the exit point, at the output point, where we can have another set of UV lights disinfecting the air. The air is still going to be air. It's no contaminant from the UV. That's just one example. So I'm hoping that everyone had looked into the sites that I put on that resolution. I'm also hoping that you all had some opportunity to have done some research just for your own knowledge, and I'm looking for this to pass this evening. Can't hear you.
My apologies. Director Arroyo, would you, I know the last time we spoke at length about the UV rays, and it looks like Councilman Sanchez corrected the concerns from the last time we spoke. Would you like to, the floor is yours if you have any comments.
I don't have any concerns as it's been amended and as it's been explained.
Great. Any questions from my council colleagues? Yes,
Councilman LeBron?
Councilwoman Rossetti, yes. Floor is yours.
I just want to point out, and again, I love that Councilman Sanchez thinking out of the box, looking at different things, but I do want to go back to some of the things that Leonie mentioned, which was we don't want to, and I can see this happening, give people any false sense of security to not be as vigilant with the things we are continuing to do, which is, hand sanitizer, washing your hands, social distancing, mask wearing. And also, again, because I appreciate our Health and Human Services Department after what we've been through, I want us to be mindful, and I assume she will be honest with us, because everyone is at the city, that we have, the resources to do this. I still think it's a wonderful idea. I just don't want to trade one, extreme for something else. So would you mind to speak to that?
Sure. Obviously, time and capacity is always a concern for us here at the city. We do have many things that we're trying to tackle in addition to the pandemic, and our work continues in spite of the pandemic. We still have deadlines to meet. We still have budgets to produce. We still have grants to write. I would view this as something that we would look into and do some, sort of light research into to provide to the council. But I don't see us or foresee us spending a lot of time on this to be upfront with you all because of capacity. But it's something I think, just given the explanation and what has been stated, is something that we can likely get done fairly easily, given the more reduced scope that we're looking at now.
Thank you for that. Councilman Clark, any comments or? All right.
No, Mr. Chair, I make a motion that we move with favorable recommendation to the next council meeting.
And I second it.
Has been voted and seconded, and so approved. I also vote in favor of it. So approved favorably to the council.
Thank you, everyone,
All right.
for your support.
Thank
Yes.
you, Councilman Sanchez.
Thank you, Councilman Sanchez. And I know you have another obligation, so thank you for joining us.
Take care.
All right, take care. All right, so the next item is referred item number 3 of council meeting June 22nd, 2020, communication from Mayor Bronin with the company resolution authorizing the city to accept a grant of $394,718 in funding for the Department of Health and Human Services for the National Foundation for the Centers for Disease Control and Prevention, Inc., CDC Foundation. The floor is yours, Director.
Sure. Thank you, everyone. So we were invited to apply for a grant from the Centers for Disease Control, the National Foundation for the Centers for Disease Control and Prevention. They are a completely separate entity from the Centers for Disease Control, which is a government agency, but they do work and fundraise and engage in projects to support the work of the CDC. And so we were asked to submit an application with the work that we were doing as it related to communities of color and our response to communities of color during the pandemic. And so using that as a background and the work that we had already started to engage in and understanding and seeing the gaps that existed in that work, primarily around funding and communications, we worked to put together a proposal that addressed that. So there are several pieces to the proposal. The first one is increasing access to testing and information around testing and COVID generally, but really increasing that access to testing. And it's both the PCR testing, which is actually testing to see if a person has an active COVID infection, as well as antibodies testing. We don't want our community to be left behind as it relates to both of those. And in this case, both of them are really related to working with our undocumented community who does not have access to health insurance and may not be able to to take advantage of that. So while at this point in time, we know that the PCR testing, which is a test for to check if you actively have a COVID infection or have an active COVID infection at the time, is covered. We know at some point that may not be the case, and so we wanted to prepare for that. And then the antibodies testing, we know it just really differs from insurance to insurance, whether you have to pay a copay or not. And since there isn't a standard on that, we wanted to make sure that we had some funding for that as well if co-insurance was a factor for people in being able to obtain that test. And then also, again, for our undocumented community who may not have insurance and may not have the funds to be able to pay for that test. So access to both of those tests we felt was critically important for members of our community. So while it's not an endless pot of money to do that, we do have some money to pay for a couple of hundred tests in each of those buckets. In addition to access, the next big piece was really around not just being able to get the test, but being able to get to the test, which we know was an issue for many in our community. So we will have, we put in additional funding to continue to pay for taxi rides to testing sites for our community members. So that program has been going pretty well over the past couple months, but we wanted to make sure that we had sufficient funding to continue that over the next year. So there's funding for that. Next, we also had conversations about the fact that there is definitely a need for information in the community around both the testing, the antibodies testing, as well as COVID generally and how to prevent it. And so we had engaged already in a communications campaign with our 2 hospital partners in the United Way. So now this is giving us an opportunity to actually do some paid advertising. So working with local media to do some paid work in newspapers and local newspapers, in local radio and places where we know the community is accessing. And there may be the potential as well for bus ads. So there's some limited funding there. But we also know that when we're doing this work, that just seeing something in the media is not sufficient for many in our community. And so we're actually going to put boots on the ground. We're going to be issuing an RFP, likely within the next 2 weeks, that will be seeking 5 organizations to receive grants to for up to $15,000 to do work and to work with us here at the city to do a number of items. First is getting those materials that we've produced with our hospital partners in United Way out into the community. Second is to do more education in the community. So working with existing programs and working with existing groups to go out and get information around COVID and COVID prevention. And then also to promote testing. You know, there's a little bit of pandemic fatigue and testing fatigue. And so we want to make sure that we have people out there constantly getting this message out and reinforcing the message that they're hearing from us here at the city, as well as from our state partners. So that's the next piece. And then lastly, what I think is frankly the most important piece of this proposal is we know that there are several vaccine trials that are occurring, but we also know that there is a very strong anti-vaccine movement that has been developing over the last number of years. And we're seeing that starting to rear its ugly head now as it relates to the COVID vaccine. And so given our experience with the flu vaccine here in the city, we thought it was important to prepare the community and for us to get prepared for what would a COVID vaccine mean? What would a coronavirus vaccine mean for our community? So we put funding in there to do 10 focus groups of 10 individuals each to reflect the diversity of the city of Hartford and have conversations with community members about what do they know about the coronavirus and COVID, what don't they know, what do they think about a vaccine, what would motivate them to get a vaccine or to not get a vaccine, what are the concerns that they have about the vaccine, and then who would be the right messengers and what would be the right message that would get them to want to get vaccinated. Money then will also then be used to develop messaging and develop collateral materials, and then test out those collateral materials again with focus group members. So we're looking at 5 focus groups to start with, and then 5 focus groups to test the materials. So that is, I think that to me the most important piece is we're thinking towards the future and what the future holds for us as it relates to vaccine is to ensure that our community members are not left behind and that we have the information needed to motivate them to get vaccinated when and if that vaccine comes our way.
Thank you. I'll open up the floor to my colleagues. Is there any questions? Councilman, Majority Leader Clark.
Thank you, Mr. Chair. To you, thank you, Director Arroyo, for your report. Within all that you just talked about in your report, this deals with the funding from the CDC Foundation? Okay. And so is there any funds in there as it's been outlined for work outside of the hospital networks?
Well, it's all outside of the hospital networks. All of the funding is for that. We want to promote testing and promote all of our testing sites. There's a real concern about the fact that numbers and many of our testing sites could be higher and should be higher. And that we do, our two largest testing sites are our hospital systems. And so we want to increase the percentage of Hartford residents that are also getting tested through that mechanism. But we also know that our FQHCs and our federally qualified community health centers that we've already partnered with, our pharmacy partners as well, are important. So there's not money directly going to those organizations per se at this point, but it's more along the lines of helping to promote all of those sites and helping to get the community through those doors so that you all can do the testing that is needed in the community.
Thank you for that. Also, too, so with the media campaign, is it going to be specifically just for the two hospital partners here in the city, or no? Okay.
No, it won't be, not at all. So they partnered with us to help create the materials. They used their graphic designers and their folks. So that was the partnership that we had with them. And they participated in terms of expertise with the work that they're doing in their Fury Clinic and on their COVID hotline. But it's open to everyone. And as we get individuals that are interested in wanting to do that work, absolutely. But it's not limited to them and promoting their sites, not at all.
Okay, thank you. Because what concerns me is when I take a look at the numbers and I see that the numbers regarding the largest testing sites, well, testing zip codes for infection rates continue to be high, such as 06106. You got what I believe 06120. Just the residents in that zip code they're just not getting tested. And so conversation I've had last week, because when we were over at Milner, it's okay number, but I think it could have been better. And then what I hear from people is the fact that they don't want to get tested because of the fact that they don't want to know. And I don't know, you probably heard the same thing. And it just really frustrates me because I get the sense that people want to get tested, but they have this fear mechanism. And then God help us when the vaccine becomes available. And I think that that's going to be a larger cry from many people within our city and cities, urban cities across the state and country on why they don't want to just because of past history. I think that this type of campaign and engagement and focus groups is something that's very necessary so that we can really get that message out loud and clear to many individuals. Because speaking with somebody yesterday, they want to know, well, what type of outreach is being done? And so, well, there's outreach being done. There's always going to be something greater. And I'm glad that the city has been invited to apply to these funds from the foundation so that we can continue on the outreach. And if I heard you correctly, that it's going to be an RFP out to a community organization to help out with outreach. How many? So it's going to be one CBO, or it's going to be split up between how many?
We're looking at 5 awards of $15,000 each, and that would cover for a 1-year period to work on specific outreach around testing sites and information in particular neighborhoods. So we're looking at our hardest hit neighborhoods and looking for community-based organizations to work in those neighborhoods. And so we'll be looking at their capacity to do this work, as well as their reach into the community, and how quick they can get off the ground. But it's a small grant, but it's something to start with. It's more than what we had. And again, the vast majority of this money is going out the door in either the form of these grants or through the media campaign, incentives for the focus groups and things, and printing and all of that. So the vast majority of this funding is going out the door in numerous ways to benefit the city.
Wonderful. And since I know you have taken a lead role in the city from a census standpoint. Have you or your team had the opportunity to take a look at where our numbers are high as far as the zip codes for infection rates and how that equates to the numbers of in the same areas where the census has not been completed yet?
Sorry, let me unmute myself. So I would say we've not done that work, but I just knowing the numbers, I would say there's a lot of overlap.
Yeah.
So I would definitely feel comfortable stating that, though we do have to dig down deeper. We also want to look at the percentage of individuals and communities that have been tested, not just the infection rate. We want to get an idea by on a per capita basis, how many people in a particular neighborhood or in a particular zip code have been tested. So that way, if we're seeing lots of infections from that particular neighborhood, but not a lot of tests coming through, that those will be neighborhoods that we would want to focus on. But I think we all know, I mean, there's particular neighborhoods because of density, because of poverty that we're going to focus on. We know Northeast is always going to be a concern. We know Frog Hollow is always going to be a concern. Those are two areas that we're definitely going to want to go in and do more work in. We want to look at other neighborhoods. You have lots of individuals in our community that are essential workers. So we want to look at that data as well to see where do we have our essential workers that will be working no matter what happens if there's a second wave, right? You know, if there's a second wave, things are going to stay open and people have to work. So we want to make sure that we're also looking at those communities and those zip codes. But we're looking down to the census level data at this point in time, not just zip code data, but census level data.
So has there been, and I'm sorry to monopolize all the time, I love this kind of stuff, being in it every day, but has there been any conversations regarding when this wave 2, to me, we're still in wave 1. I don't know when the wave 2 is going to be continuation, but conversations as to the continuation of mobile testing or how that would look when this additional wave comes in the fall time to collide with the flu season?
So we're starting conversations in the department about a couple things. One is flu and looking to do flu vaccine clinics where we are doing drive-through flu vaccine clinics. We know that there's an issue with the fact that there's been a big movement towards telemedicine, which is fantastic and great, but you can't get an immunization through a webcam, right? You have to actually go in person. And so we're having conversations about the fact that we want to do education around the flu. And we've had some brief conversations last flu season, and that conversation we're going to pick up again to have some modest funding to potentially do an outreach campaign around the flu. So that's one thing that we're looking at right now and restarting those conversations with that particular funder to see if they can support that. In terms of what a wave 2 could look like, I stated on Friday, we're still at the tail end of wave 1. We're still getting infections, right? We still haven't completely reopened the economy. People are still not back in the office. And that's why our numbers are low. Lots of people are still home, even though the economy is reopening and businesses are reopening. When we think about a wave 2, what that looks like and when that can be, who knows? The best guess for most indications, it looks like it could be the fall. Simply because everything's looking to reopen after Labor Day. That's like what we hear from many folks that I speak to, that their companies are saying they'll reopen again after Labor Day, right? As I'm sure you're all aware, the governor announced that he's pushing back phase 3 reopening. So he's obviously concerned, as we all are, with what we're seeing across the country. I'm not sure if you saw that in Hoboken, New Jersey, they had an uptick in the number of cases over a few days, and all of those cases were traced back to people who had traveled to Florida. So those are the things that we're looking at, and that will start to dig deeper into our data with the small numbers of cases that are now coming in that are positive to get more information. But we haven't seen any trends yet. But we're working together. We want to do an after action review with all of the individuals that were part of our first meeting, and then do a second planning meeting again as we think about a phase 2 or a second wave.
Thank you. And I got one final question, because I'm not going to have Councilwoman Rossetti after me. I know she wants to jump in.
No.
From the you just hit on the touch point regarding wave 2 with the governor pushing back the round 3. With respect to the recommendations from the Public Health Advisory Work Group, where is the administration on some of those recommendations, short term, and albeit long term, but really short term when it comes to also to driving more testing for our children?
So my understanding is the administration has been reviewing. I've also seen the recommendations that have gone in. I will say I feel very lucky about the fact that many of what was said as a short term and even a medium term recommendation are things that we were already doing, we're looking to do more of, or we're planning to try and start doing, just looking for resources for. So I feel we're in good shape with our short term and probably most of our medium term recommendations. Again, I haven't done sort of the side by side of everything, but I've been a part of those meetings and I've read and participated in some of those groups. I feel we're in good shape. As it relates to children, we do know that there are some sites that are more able to do, that are more likely to do children than others. So I think that's something that we're going to have to explore. And I think we're going to also have to explore what ages of children. We know that children that are older are much more effective in spreading, just simply because if they sneeze, they can sneeze with the same force as of an adult. But if you're a younger child, your sneeze may not carry as far or may not be as forceful, right? So I think there's still a lot of stuff that we just don't know about children and what that will look like. But there are conversations that are ongoing. We continue to look at the data. HPS has reached out to me and I have a pending conversation with them around testing as well. So those are all things that we're looking at.
Thank you, Mr. Chair. I have many more questions, but I will talk to Director Arroyo offline.
So just we're also part of the agenda. We're going to talk about the recovery group and furthermore. So, but Councilwoman Rossetti.
Thank you. First of all, Director Arroyo, I know I say this often, and I'm going to say it more times as the months and years go by, I'm sure. But thank you again for just supporting us at a time when we really needed someone, and personally for supporting the work we do. And I know I speak for my colleagues on just how proud we are to have you at the helm. With that said, and it may have been addressed at some point, how do we interact with people? And there are people, believe it or not, who don't have email or do social media. How do we reach out to them in a way that's, maybe meaningful or trackable, that kind of thing?
So that's where the paid advertising can come into play here, right? We have worked with our local radio stations and they have given us some earned media. But we're also looking at doing some paid media. Could we do some PSAs? Could we do some work like that with them? And then that's also where these 5 subcontracts that I discussed earlier would also come into play, right? So we know that there are CBOs that work with a variety of different communities. So could a CBO that gets a grant work with the West Indian Social Club? Could they work with the Cricket Club? Could they work with the the softball teams? Those are all places where we can meet people where they're at. Could we do work in laundromats? On Saturdays, laundromats are packed, right? Because many of our residents don't have in apartment or in building laundry. So these are all the kinds of things that we're going to be looking for in these RFPs, for people to be creative about where they're meeting people. And many of these things are also going to be tied around particular efforts that we might be trying to promote. So, we do have a lot of mobile testing that's ongoing, and we know that much of that will likely, some of that will be coming to an end at the end of July. We're looking to extend that further out to get closer to the start of the school year as well. But the reality is we also have 11 testing sites in the city right now. We're not that large of a city with 11 testing sites compared to some of our other larger cities that have a larger population, but also a larger land area that have much fewer testing sites. And so we also want to drive people to those existing testing sites in communities, right? So, and use that mobile testing or looking at using that mobile testing for people that can't necessarily get out of their buildings or out of the communities that they live in. So some of our senior housing and elderly housing. So looking at different ways to promote that, but that's some of the ways that we're looking at doing that, doing paid media and working with community health workers to go out into these communities and provide that information as a trusted voice and a trusted source of information.
Thank you.
So, Director Arroyo, so I have a question in terms of the rides. I've had some constituents reach out to me in terms of rides, and so it's hasn't gone as smoothly for some families as we have wanted to. So with this grant from the CDC Foundation, what is the, in particular, focusing on the rides and getting them access to the testing, what would be done different?
Well, I've not been made aware of challenges. The challenges that I've been made aware of have been individuals from outside of Hartford wanting to get a ride into Hartford to get tested. Or individuals calling with wanting to go get tested but not having an appointment. We are requesting that people have appointments, even though there are walk-up sites. We are really pushing the appointment piece so that we know people are going there and then coming back, and that also helps with the timing of the ride, because the ride is not a set piece where you get driven there and come back. There's a waiting period and there's lots of things attached to that. So that's what we're pushing. I'd be happy to have a conversation offline with you about what these challenges are and figure out a way to address them. We do work with 311. They manage the ride system. And so if there's any challenges, please let us know and we can work closely with them to solve them.
I think the issue, maybe it's been solved, and maybe you're right. It was more than a month ago when rides weren't being promoted. I think it was with the insurance companies and offering rides through the vendor. I forgot what vendor they're using, particularly the Medicare vendor.
That's Vail. We were made aware of some challenges with that, and we did reach out to DSS and DPH around that. There was a point in time where individuals who have Medicaid who can use Vail for medical transport were being denied service to testing sites. And so we did reach out, and we were told that these the Vail drivers all have access to the appropriate PPE and can use that as a mechanism to get there. Of course, that is a service that's already being provided. We would want to promote that as well and have this as a secondary service. But my understanding is while this was going forward, Vail wasn't even running at the time for this. So we were definitely filling in a critical need. And I expect that we can continue to fill that need and backstop Vail as needed.
So it's just for clarity, for the folks listening. So the rides will be provided by the city, or we're going to be subcontracting that out?
Well, the rides were never provided by the city. We pay a vendor to provide rides, and they charge us per ride. And the cost per ride varies depending on the wait time and a number of other factors associated with that. But they provide us with a fee schedule that we've agreed to for that, as well as making sure, and that includes that their drivers have the appropriate PPE and everything else, that they wait if they're doing drive-through testing and a whole bunch of other things that we've worked with them. But that's who's providing the rides. It's a vendor who made themselves available and has done medical transportation before, but then also made themselves available to do COVID positive transportation as well as testing transportation.
Thank you. So any other questions from my council mates?
Motion for favorable recommendation.
Second.
All right, I approve. So motion has been properly favored and seconded, and I also approve. So we're going to send this back with a favorable recommendation to the council meeting. Thank you, Director.
Thank you.
All right, so we have, as you know, we're in the middle of a pandemic, so I always want to allow you to talk about really at the high level some things that are going on. So we start off, and this is just communications. Just if you, the floor is yours in terms of, we have 3 items under number 3. Number 1 is the COVID update. So we'll start with that. The floor is yours if you want to, you're on mute. Let me unmute you. There you go. All right.
Sorry about that. As of this morning, we have a total of 2,642 cases of COVID in the city. 526 patients have been hospitalized, or residents have been hospitalized during the pandemic. Again, that's from the start till now. And we have 160 residents that have either died, whose deaths are directly attributable to COVID or are believed to be COVID related. And that number won't be finalized probably for a while longer, because those cases have to go through the Office of the Chief Medical Examiners. So that's where we stand today. What does that mean? Thus far, we have 14,457 residents that have been tested. That's about 11, close to 12% of our population, which is fantastic. So we do see our number tick up. It's not going up in terms of testing as much as it was initially when testing was expanded, but it continues to go up, and every day we get more people tested. And every day we're seeing, less cases and a lower test positivity rate, which is fantastic. So our test positivity rate, fluctuates from day to day. And by that, I mean the number of people who have been tested and those that have tested positive. So that fluctuates, but we've been as low as 2.5% to, we got to about 10% or 11% at some point last week. But again, it's fluctuating, it's daily fluctuations. How many people get tested can impact that as well. But we continue to see those numbers, the testing numbers sort of kind of stay a little stagnant, and we want to do this promotion of testing as well to get them up. Zip codes that have had the highest number of cases, the zip code with the highest number of cases is 06106, followed by 06114, and then 06112 and 06105. And that's including our nursing home population, just so that you know that that's, we did have a lots high numbers in our nursing homes. At one point, that seems to have stabilized a great deal. And our nursing homes have been doing fantastic over the last, I would probably say, month or so in terms of the number of cases that have come from there. Other interesting facts, we still have, in terms of the percent of our COVID cases by race and ethnicity, a large number of test results that are coming back as unknown race or ethnicity, which for us is a concern because we just don't have a good idea of how people are getting tested, and are they underrepresented or overrepresented in testing, and any work that we need to do there. I would venture to, to say that a lot of those unknowns are obviously Black or Hispanic because of the population of the city, but we just don't know. And so we're just keeping an eye, and we talk to our partners about making sure that they collect that information because it's helpful to us. Other than that, hospitalizations have been in a nice steady decline. A couple days, it might spike for a day and then drops back down again. But all the trends are going in the right direction, and we're really, really pleased with the work that has been happening and the work of our team. Do want to give you an update as it relates to contact tracing, because there's been lots of questions and comments and concerns about that, and lots of things in the news about that over the past couple weeks, and the role of the state. As I had mentioned previously, we've been doing contact tracing since the beginning of the pandemic. From the day that we got the phone call of that first case, we started contact tracing at that point in time. And so we've done that work, and we did an analysis through June 10th, I believe, was the date that we ran the analysis through from the first date from our first case through that date. And what we found was the following. At that point in time, we had about 2,400, a little over 2,400 cases. Of those 2,400 cases, there were only 1,980 that were deemed to be traceable. That means that they're not in a congregate care setting. So they were not coming out of Department of Corrections, or they were not coming out of nursing homes, because we are not responsible for contact tracing in those environments, right? For obvious reasons. And then there were 50 individuals that were positive that we had no contact information for. Nothing was, we didn't have phone numbers, we didn't have emails, we didn't have an accurate address. So we have 50 people that we were unable to contact because of a lack of information. And so of those that were left, it was about 1,980 or so that were left. We actually contacted over 90% of all of those individuals. And by that, I mean, we had a procedure in place that we reached out by phone to each positive contact, to each positive case twice. If on the second phone call we did not hear from them, we then sent them a letter asking them to call us. And I will say that people called us back when they got that letter. They wanted information. And so the contact that we made with those positive cases was either us calling them or them calling us back. And so we were able to make contact with like over 1,700 individuals that tested positive. So those individuals received information on how to manage the disease, when they can return to work, how what to look for in case they needed to go to the hospital or return to the hospital, and also how to protect their family. And in doing those contacts as well, we learned about individuals and their family who were also sick, but had not been able to get tested. So in some cases, we were able to intervene and assist in getting family members tested as well. So our team continues to do that work. In early June, we were within 24 hours contacting individuals. So if a case hit our system on Monday by the state, on Tuesday, they were getting phone calls. So we continue to do that same work, including over the weekends. So we now have individual volunteers that are working with us over the weekends as well. When cases come in in the morning, staff members will then assign those cases to our volunteers.
We had finished on a COVID update, and there was a question from Council President Rosado regarding the demonstrations and the protests that have been going on in Hartford and it not affecting the spike. So if you can quickly go into as to why you feel that is.
So I will say that we've not seen a noticeable spike in cases over this past couple of weeks. What I saw, and I think what many of us saw, is that many individuals that were protesting and demonstrating were wearing masks, though there were some that weren't. I would say that the majority, if not the overwhelming majority of individuals, were wearing masks. And I think that goes to show that if you wear a mask, even if someone next to you isn't, but you are, you can help cut the transmission. So we just really need to encourage everyone to continue to wear their mask. It's one of the easiest things that you can do and one of the most important things that you can do for the safety of yourself, but also of your community.
Thank you for that. All right, and we'll go on. Recently, we had a budget approval that saw some shifts towards the Health and Human Service, and obviously that makes sense. I'm considering we're under a pandemic. So if you want to briefly discuss your thoughts on, number one, the budget reallocations towards Health and Human Services, and how you plan to utilize those funding, and where is it supposed to be focused on so the general public can be aware.
So the shift in funding that we received was additional funding allocation to two of our senior centers here in the city, our two largest senior centers in the city. So we will be actually meeting with those senior centers in the next week or so to talk about where some of that allocation should go to. We do know that there's obviously a need for some pay increases for some staff there, but also a need to plan for the pandemic and a need to keep that at the forefront of the work that we're doing with our seniors. So how we can allocate some of that funding either to some PPE, to provide materials to some of our seniors who may need it and things of that nature. But it'll be, a didactic conversation between the agency and us to ensure that the money is used in the best way possible, with an eye towards health and safety of our seniors. And then the additional funding for inspectors. So we have many classes of inspectors within the city, and within my department specifically. We actually have 4 levels of inspectors that we have. We have what are considered sanitarians. Those are individuals that inspect our restaurants, inspect pools, inspect the anything that's dining facility or safety facilities, such as, like I mentioned, pools. But they're the ones that do our restaurant inspections primarily. That's what they're known for. So we have that classification. We also have what we call public health inspector classification, which are our lead and our nuisance inspectors fall under that classification. So if there's overgrown weeds and things of that nature that are leading to eyesores in a community, that's the inspector that would go out. And then we also have rodent control inspectors. And so the funding that we received is enough to do 2 inspectors in 2 different classifications. One will be an additional sanitarian, and that's a restaurant inspector. So we're looking at bringing someone in. If we can find someone to come in as a full-fledged sanitarian, that would obviously be ideal. But full-fledged sanitarians that already have all the training are hard to come by. So we might do a trainee position. So that's someone that will come on and have 18 months to get trained with our staff to become a full-fledged sanitarian. In the interim, they can do other inspections that do not require the restaurant inspection certificates and things that are needed for that, so they can help backfill some other areas while they're getting their training to do restaurant inspections. And then the other inspector that we are looking to bring on board would be a nuisance inspector. We currently have 2 for the entire city, and so we want to increase that by 1 more, and that would make a nice complement to our work. That would bring us, we would have 3 rodent inspectors, which was something that was approved in the last budget cycle. We went from 1 to 3. Then we'll have 3 nuisance inspectors, and then we'll have an additional sanitarian, which will bring us from 7 to 8 sanitarians. So that's how we're looking. And all of those positions, particularly that sanitarian position, is critical as it relates to COVID, because right now they're doing inspections for reopening as it relates to following the COVID rules and the COVID guidance. So that's the kind of work that we're looking at. And then on the public health inspector side, or i.e. nuisance inspector, having that 3rd one will work nicely with our rodent inspectors as well, because they work closely with our rodent inspectors to talk about harborage, for rodent harborage. And then they also play a key role with our restaurants as well, because if there's a lot of trash that's not being picked up, that can obviously create rodents and other issues that can impact a restaurant. So it works closely. So it's a good bridge between both the 2 other classifications of inspectors.
Thank you very much for that update. I don't see, no one has asked me for questions. I know that Majority Leader Clark asked about the public health recovery work groups. You added to that and you stated that. So I don't think it's necessary to dive on that. I've looked and asked to see if there's any new business, and I don't think that there's any. So I take a motion to it. Unless you want to take the floor, or anybody else wants to take the floor, I take a motion to adjourn.
So moved.
All right, so this meeting is adjourned. Thank you, everyone, for attending the meeting. Thank you, Director Arroyo, for your continued dedication to the city, to the population, and for keeping us all safe. I appreciate it.
Thank you.
Thank you. Bye, everyone.
Thank you.
Bye.